Our first guest is Dr. Lydia Laboccetta, a new urologist in the area. Welcome to the show today, Dr. Laboccetta. It's so nice to have you.
Thanks. So nice to be here.
Great. Now, I know you're new to the area. How long have you been here?
Well, we just moved here when I finished my residency. We literally moved here like the day after I finished.
The day after.
But it feels more like a homecoming than anything else because I'm 10th generation North Carolinian, and I love it here. My grandmother grew up in Wilmington, and we've spent every summer that I can remember here. So my husband and I met actually in Wilmington, and we've been working our whole marriage to get back here. So our dreams are coming true.
Oh, that's wonderful. Great story. Great story. So where did you relocate from?
I was doing my training down in Charleston at the Medical University of South Carolina. And Charleston is amazing. I mean, I was so lucky to get to train there. But we're really glad to come home.
I'm sure you are, and it's a great place to live. People are wonderful, and the weather and the water.
The water is the big draw, I think, for us. The clear water and just it's amazing.
Yeah, that's great. Well, tell me a little bit about your education. You said you went to MUSC.
Yeah.
And that's where you did your residency. Where did you go to undergraduate school?
I actually did my undergraduate degree at Wake Forest in theater. So that was
theater
a while back. And then I did my medical school training at Eastern Virginia Medical School in Norfolk. So we've been on the coast for the whole thing. So, yeah.
And so your specialty is urology.
Yes. Yeah.
And tell me a little bit about that. How you got into urology and.
Well, I think that somehow in medicine people just kind of figure it out. I would never. When I first started thinking about going into medicine, I would never have thought that I would be a urologist because, frankly, I didn't know what that was, But I initially thought I wanted to do primary care because I really like patients. And then as I was kind of coming through, I was so drawn to the surgical aspect of things. And I think that urology is just this amazing relationship with patients where it's similar to primary care in that you have patients that you see for their vasectomy and then their kidney stone and then their prostate cancer, and you have this continuity of care, but you still have that surgical background that I enjoy so much. So, and it's this really intimate relationship.
I bet it is.
We talk about things that are so delicate. People tell me things every day that they've never told anybody else, and I think that's just such an amazing trust, and just I love my job.
It builds a strong relationship, and it's obvious that you love your job.
Yeah, I've had a lot of
jobs. You're very passionate.
And I like this one the best.
Well, let's talk about urology a little bit in terms of what organs would be involved, because some of our viewers may not know actually what a urologist does. So let's start with what organ systems you might.
So initially, anything dealing with urine. So the kidneys, the tubes that drain the kidneys into the bladder are the ureters, and then the bladder, and then the prostate kind of sits at the base of the bladder. The urethra is what you pee through, and then the penis and the vagina. And these are things that I talk about all day long. So really anything that can happen to any of those things is something that I would treat. So, we see a lot of stones. This is the stone belt. We see cancers originating from any of those organs. And also something that a lot of people don't consider is the adrenal glands, which are a little organ that sits on top of both kidneys. And I had a lot of experience treating adrenal masses and nodules and things like that in my training. So.
Now, you touched on surgery and that you really like to do surgical procedures. And I understand you'll be doing many of those at Brunswick Medical Center. So let's talk a little bit about the procedures that you might do there.
Sure. I think that the thing that most people know a lot about nowadays is robotic surgery. It's very well marketed, and and it's really fun.
Is it really fun?
It is. It's, you don't want to tell patients that it's like a video game, but it's like a video game. It's this really cool application of technology that is definitely changing the way that we practice, because some of the most invasive procedures that we used to do are the pelvic floor surgeries. The pelvis is like a bowl, and when we're operating down in that bowl, you really have to get a lot of what we call exposure. So people had to be kind of open from stem to stern to get down there. And the biggest advance in robotic surgery is the wrist action that we have that allows us to just kind of tunnel down into this bowl and do very, very fine surgeries. So it's something that it's one of the reasons I'm kind of glad that I was a little bit later coming into medicine, because honestly, if I had trained 10 years ago, I wouldn't have had the same exposure to it. So
yeah, it does seem to be the thing of the future, and it's here now, but.
Yeah, at our tiny little hospital, we have a Da Vinci robot
That's so amazing to have it in Brunswick County. I'm so excited about that.
I know.
Not that I want to have it, but I'm glad we have that option.
It's a great resource, and it's such a bragging point. And, you know, we do every other minimally invasive technology. We treat kidney stones with tiny little telescopes that go all the way up to the kidneys, and we can put little laser fibers up there and blow up the stones. My father-in-law actually suffers with kidney stones, and he's told me stories about how he had to have open surgeries for his kidney stones 30 years ago. And nowadays there's no reason for anyone to suffer with a stone. I mean, I can treat it and street it. You know.
And that's the lithotripsy?
Well, there's a lithotripsy from the outside that's using ultrasound technology.
Right.
And that breaks up the stone, hopefully into parts that are small enough to pass. But some stones just
won't break.
They don't respond to that treatment. We have to be able to see it on an X-ray for one thing, and some stones you can't see with an X-ray, and then and some stones just don't fragment very well, so we end up having to go up and chase them down. But yeah, we have all that at our disposal here. So.
Wow, I know that. Some folks suffer from incontinence. I would think that would be a big thing. Can you talk a little bit about incontinence and what causes that, and some of the treatments for that?
Definitely. That was actually an interesting part of my training down in Charleston. I worked with Dr. Eric Rovner, who is literally a world leader in incontinence. Believe it or not, there is actually an International Incontinence Society. So, and he's a member of that. And, you know, one of the things that was just kind of drilled into me in my training was that the most important thing about incontinence is understanding where it's coming from. So, you know, leaking isn't leaking. Some people leak when they cough or sneeze. Some people have what we call turnkey incontinence, where they are getting home and they're like, oh, I'm not going to make it to the bathroom. And just understanding the differences between and among the different types of incontinence helps to direct our treatment. And unfortunately, I saw a lot of women, especially in my training, who had been treated with surgical therapies for more of a medical incontinence and had kind of been drug along for a while. So, I mean, I think the most important thing is to open the dialogue with someone who understands that it is a complex issue and that can kind of help you tease out what exactly you have wrong with you before we start talking about treating it.
Well, I know I've learned so much today, and there are so many other topics we could talk about, but we just don't have the time today. I'd love for you to come back so we could look at some of these other areas. So let's talk about your practice. The name of your practice is?
Novant Health Urology Partners.
And you're located?
We're right next to the hospital.
Right next to the hospital in the new medical office building there.
Exactly.
And how might patients make an appointment to see you?
They should call our scheduler extraordinaire, Jill. The number at the office is 721-4150, and she should be able to get you set up.
Do patients need a referral, or can they self-referral?
We have a lot of self-referrals. We get lots of referrals from the ER. And I think it's always very important to have a primary care physician who's your head coach. But that shouldn't prevent patients from coming to see me.
Okay, great. Well, it's been a pleasure having you here. I look forward to seeing you very soon.
Thanks. So nice being here.